NLN Next Practice Questions Free. Question 1. Which dose volume gives 125 mg from a supply of 250 mg per 2 ml in this medication math item? Option A 0.5 ml. Option B 1 ml. Option C 2 ml. Option D 1 ml. 1. The correct answer is option. Set up the proportion 250 mg, 2 ml equals 125 mg x ml, so x equals 125 times 2, divided by 250 equals 1 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 2. During a quick next review of a reading passage item, which word is closest in meaning to comply in a health article? Option A, refuse. Option B, describe. Option C, wander. Option D, obey. The correct answer is option. Comply means obey, so that choice matches the meaning in context. Refuse means decline, not obey. Describe means tell about, not obey. And wander means move around, not obey. Question 3. After checking the choices in a grammar check item, which answer identifies the process moves water across a semi-permeable membrane? Option A, exocytosis. Option B, mitosis. Option C, osmosis. Option D, transcription. The correct answer is option. Osmosis is the diffusion of water through a selectively permeable membrane. Exocytosis moves materials out of a cell, mitosis is cell division, and transcription copies DNA information into RNA. Question 4. If a word knowledge stem gives one clear clue, which inference is best supported by the passage, a clinic sends appointment reminders, and missed visits decline? Option A, patients cannot benefit from reminders. Option B, appointments no longer need scheduling. Option C, reminders caused more missed visits. Option D, reminders can help patients remember appointments. The correct answer is option. The decline in missed visits supports the role of reminders. Patients cannot benefit from reminders is not supported by the passage, appointments no longer need scheduling is not supported by the passage, and reminders caused more missed visits is not supported by the passage. Question 5. When time is limited on a data table question, which answer identifies the transfer of heat through direct contact? Option A, conduction. Option B, convection. Option C, radiation. Option D, evaporation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Convection moves heat through fluid circulation, radiation transfers energy by waves, and evaporation is liquid changing to gas. Question 6. Given the information in an algebra review item, which average results from scores of 75, 79, and 83? Option A, 77. Option B, 79. Option C, 237. Option D, 8. The correct answer is option. Add the 3 scores to get 237, then divide by 3 to get 79. The other choices use the sum, the range, only 2 scores, or an added value rather than the mean. Question 7. Suppose a similar heart rhythm item appears on test day. Which word is closest in meaning to deficient in a health article? Option A, lacking. Option B, peaceful. Option C, bright. Option D, complete. The correct answer is option. Deficient means lacking, so that choice matches the meaning in context. Peaceful means calm, not lacking. Bright means full of light, not lacking. And complete means whole, not lacking. Question 8. While working through a timed lung function set, which answer identifies the tiny air sacs exchange oxygen and carbon dioxide? Option A, villi. Option B, bronchi. Option C, nephrons. Option D, alveoli. The correct answer is option. Alveoli provide thin, moist surfaces where gases diffuse between air and blood. Villi absorb nutrients in the intestine, bronchi carry air toward the lungs, and nephrons filter blood in kidneys. Question 9. Before choosing an answer in a digestive process item, which inference is best supported by the passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, timed sets remove all content gaps. Option B, the exam has no time pressure. Option C, comfort never changes with practice. Option D, timed practice can build exam familiarity. The correct answer is option. The passage connects timed practice with increased comfort. Timed sets remove all content gaps, is not supported by the passage. The exam has no time pressure, is not supported by the passage, and comfort never changes with practice, is not supported by the passage. Question 10. A student sees this homeostasis idea on a NEX review. Which critical thinking response best fits this situation? A test item asks for the best answer, and two choices are true but only one directly answers the STEM. Option A. The longest answer is automatically best. Option B. The first familiar term should be chosen. Option C. The choice that directly answers the STEM should be selected. Option D. Any true statement is always best. The correct answer is option. Entrance exam items often include true distractors that do not answer the specific question. The longest answer is automatically best, does not follow from the situation. The first familiar term should be chosen, does not follow from the situation, and any true statement is always best, does not follow from the situation. Question 11. One scientific method practice problem tests this skill, which for flow rate delivers 0.25 L over 2 hours using a 10 GDT/ml set? Option A, 2 GDT/min. Option B, 1250 GDT/min. Option C, 125 GDT/min. Option D, 21 GDT/min. The correct answer is option. Convert 0.25 L to 250 ml, then use 250 times 10 divided by 2 times 60 to get about 21 GDT/min. The other choices come from common errors such as skipping the drop factor, using hours instead of minutes, or rounding before the final step. Question 12. Several choices look tempting in a control group item. Which word is closest in meaning to efficient in a health article? Option A, wasteful. Option B, productive. Option C, ancient. Option D, narrow. The correct answer is option. Efficient means productive, so that choice matches the meaning in context. Wasteful means using resources poorly, not productive. Ancient means old, not productive, and narrow means not wide, not productive. Question 13. For this sample size nursing entrance question, which answer identifies the chemical messenger released by endocrine glands? Option A, platelet. Option B, hormone. Option C, antibody. Option D, enzyme. The correct answer is option. Hormones travel through the bloodstream and affect target tissues. Platelet helps clotting, antibody targets antigens, and enzyme speeds chemical reactions. Question 14. In a short enzyme activity practice STEM, which answer best explains the author's point? A patient education sheet used short sentences, headings, and pictures. Option A, long paragraphs are best for patient teaching. Option B, headings reduce the value of information. Option C, clear formatting helps readers understand health information. Option D, pictures make written instructions unnecessary. The correct answer is option. The sheet is designed to improve readability and comprehension. Long paragraphs are best for patient teaching, is not supported by the passage. Headings reduce the value of information, is not supported by the passage, and pictures make written instructions unnecessary, is not supported by the passage. Question 15. Among the choices in a pH scale item, which increase is shown from Monday 12 to Wednesday 20 in a simple practice chart? Option A, 5. Option B, 20. Option C, 8. Option D, 32. The correct answer is option. The increase is the final value minus the starting value, 2012 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 16. Using the facts in a solution chemistry question, which value of x solves for x plus 4 equals 32? Option A, 8. Option B, 28. Option C, 7. Option D, 6. The correct answer is option. Subtract 4 from both sides to get 4x equals 28, then divide by 4 to find x equals 7. The other choices result from stopping after subtraction, adding one too many, or not reversing the operations in the equation. Question 17. Based on the clue in a genetics clue item, which word is closest in meaning to expand in a health article? Option A, shrink. Option B, increase. Option C, whisper. Option D, accept. The correct answer is option. Expand means increase, so that choice matches the meaning in context. Shrink means become smaller, not increase. Whisper means speak softly, not increase. And accept means receive, not increase. Question 18. Consider this high-yield cell division concept. Which answer identifies the cell division that produces gametes? Option A, mitosis. Option B, translation. Option C, diffusion. Option D, meiosis. The correct answer is option. Meiosis reduces chromosome number and produces sperm or egg cells. Mitosis produces identical body cells, translation builds proteins, and diffusion moves particles down a gradient. Question 19. Near the end of a bone support review session, which answer best explains the author's point? A volunteer program grew after former patients shared personal stories at orientation. Option A, volunteer programs grow without communication. Option B, former patients stopped the program. Option C, personal stories can motivate people to participate. Option D, orientation should never include stories. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Volunteer programs grow without communication is not supported by the passage. Former patients stopped the program is not supported by the passage, and orientation should never include stories is not supported by the passage. Question 20. Across similar muscle movement nursing entrance questions, which answer identifies the group that does not receive the experimental treatment? Option A, conclusion. Option B, sample. Option C, control group. Option D, experimental group. The correct answer is option. A control group provides a comparison for the treatment group. Conclusion is the final interpretation. Sample is the participants or items studied, and experimental group receives the treatment. Question 21. Since only one choice fits the nerve signal clue, which increase is shown from Monday 18 to Wednesday 26 in a simple practice chart? Option A, 3. Option B, 44. Option C, 8. Option D, 26. The correct answer is option. The increase is the final value minus the starting value, 26/18 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 22. From the information in an endocrine message item, which word is closest in meaning to infer in a health article? Option A, erase. Option B, whisper. Option C, conclude. Option D, copy. The correct answer is option. Infer means conclude, so that choice matches the meaning in context. Erase means remove, not conclude. Whisper means speak softly, not conclude. And copy means duplicate, not conclude. Question 23. At a testing desk during a glucose regulation review, which answer identifies the solution with pH above 7? Option A, basic. Option B, neutral. Option C, hypotonic. Option D, acidic. The correct answer is option. A pH above 7 indicates a basic or alkaline solution. Neutral describes pH 7, hypotonic describes lower solute concentration, and acidic describes pH below 7. Question 24. Inside a chart reading science or skills item, which answer best explains the author's point? A school added quiet study rooms, and students reported fewer distractions. Option A, students no longer needed to study. Option B, reducing distractions can improve study conditions. Option C, distractions are always helpful. Option D, quiet rooms increase noise. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Students no longer needed to study, is not supported by the passage, distractions are always helpful, is not supported by the passage, and quiet rooms increase noise, is not supported by the passage. Question 25. Through careful reading of a ratio setup stem, which critical thinking response best fits this situation? A graph rises sharply after a policy change, but no other information is given. Option A. The graph shows a possible association but does not prove causation by itself. Option B. Graphs cannot show patterns. Option C. A rising graph proves the policy caused everything. Option D. The policy must be ignored. The correct answer is option. A time pattern can suggest a relationship, but causation requires stronger evidence. Graphs cannot show patterns, does not follow from the situation. A rising graph proves the policy caused everything, does not follow from the situation, and the policy must be ignored, does not follow from the situation.